Assalamu alaikum dear doctor. In this video I am sharing information causes of hepatomegaly, splenomegaly and hepatosplenomegaly. So first, causes of hepatomegaly according to age: neonate, infancy and early childhood and older children. So when we find hepatomegaly in neonate, the causes are hemolytic disease of newborn, number 1, number 2, neonatal hepatitis syndrome including biliary atresia, number 3, heart failure, and number 4, galactosemia we think. Now, when infancy and early childhood we find hepatomegaly, the causes can be number 1, sickle cell disease, hepatitis, and malignancy, neuroblastoma, hepatoblastoma, that is age less than 2 years, hepatic vein thrombosis, heart failure, and glycogen storage disease, Reiss syndrome, fatty liver, and autoimmunohepatitis. This is the list of infancy and early childhood hepatomegaly. Now, older children, when hepatomegaly, we find the causes are hepatitis, secondary infiltration, hemangioma, hepatic vein thrombosis, heart failure, glycogen storage disease, Wilson's disease, alpha-1 antitrypsin deficiency, fatty liver, and autoimmunohepatitis. Liver span at birth is 5 to 6 cm. At 1 year, liver span is 6 to 7 cm. At 3 years, 8 to 9 cm. And at 12 years, 12 cm liver span. And another note is that it is better not to measure liver span if you can't remember well the different liver span for different ages. Generally, if the liver is palpable more than 1 finger breadth below the costal margin with normal positioned upper border, then it can be considered as enlarged. It is easier and safer to measure the span below the costal margin plus ascertain the level of upper border. Causes of splenomegaly. Causes of splenomegaly, again, age is infancy and early childhood and older childhood. So, infancy and early childhood splenomegaly causes are sickle cell disease, that is very young, less than 1 year old child, and hereditary spherocytosis. Lymphoma, portal hypertension, systemic onset of JIA, SLE, and Gaucher's disease. These are the causes of splenomegaly, infancy and early childhood. Now, older children causes of splenomegaly, the list is hereditary spherocytosis, subbacterial endocarditis, malaria, Epstein-Barr virus and cytomegalovirus, lymphoma, portal hypertension, systemic JIA, SLE, and Gaucher's disease. So here SLE, we find splenomegaly in older children, not early infancy. Bold, commonly seen in exam in UK, uncommonly seen in exam. Causes of both hepatosplenomegaly. Again, we divide according to age: neonate, infancy and early childhood, and older child. Now, neonate causes of hepatosplenomegaly are congenital infection, that is cytomegalovirus, rubella, and toxoplasmosis. Now, infancy and early childhood causes of hepatosplenomegaly, the list is thalassemia, viral causes cytomegalovirus, Epstein-Barr virus, hepatitis, and bacterial septicemia, mycoplasma. Leukemia, lymphoma, both cases we find hepatosplenomegaly. Biliary atresia, then chronic liver disease and portal hypertension post-Kasai, mucopolysaccharidosis, alpha-1 antitrypsin deficiency, cystic fibrosis, systemic GI, and Gaucher's disease. This is the list of infancy and early childhood hepatosplenomegaly. Older child, we find hepatosplenomegaly in thalassemia, viral, this is cytomegalovirus, Epstein-Barr virus, hepatitis, bacterial septicemia, mycoplasma. Leukemia, lymphoma, biliary atresia, chronic liver disease and portal hypertension post-Kasai, mucopolysaccharidosis, alpha-1 antitrypsin deficiency, cystic fibrosis, systemic lupus erythematosus, systemic GIA, Gaucher's disease. Now, bold, commonly seen in exam: thalassemia in Malaysia and Singapore, cystic fibrosis in UK commonly come, another uncommonly seen in exam. So, thalassemia is very important, where we find hepatosplenomegaly, and cystic fibrosis we also find hepatosplenomegaly. This is important. This is all about this video. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.